a family question for them.
I think you should ask it.
Okay. So you work with the family system. How often do you find that the person who ends up in treatment is maybe not the identified patient, or the person who ends up in treatment is in addition to the identified patient?
They're typically not the only identified patient, right? They may be, they're the squeakiest wheel, they're the ones with the, especially with youngsters and the rapid progression of drug use and abuse and how that affects the family. But very rarely, and most of our families are pretty complex. We do a pretty good assessment, and that's important to us, on the whole family system prior to doing the intervention. Especially
it's sometimes more than the families expect, because we do a big clinical assessment on everybody in the family.
And if you go in blind, there's some pretty huge, it's a huge minefield, right? And so you step into an intervention on a family, and there's some real, I'm not going to get into it, but some real secrets, some real horrifying things that come out at an intervention. And we better know that prior, things that are just awful.
I try to tell people that it's like the family's been in a car accident. And, yes, we're there to initiate some direct care quickly for an identified patient, but the whole family's been in the car accident. And they want to triage and
so we just got a call recently, a family that I've done 5 interventions in the family over the past 20 years.
Jeez.
And Michael's going to go do one soon for this same family.
Wow.
Because and we're talking about 3 generations, right, of substance abuse disorder. So usually the families are complex.